Ortho becomes a really good solution for her. She's narrow. You can see how deficient her premaxilla is and how it's almost like V-shaped. Every 5-degree change in that angle can lead to a 25% change in airway volume.
Good evening and welcome everyone. We're thrilled to have you. I am Lauren Gates, your host of this evening's Airway Health Solutions conversation featuring Dr. Andy Cohen. Welcome, Dr. Cohen. Thrilled to have you here.
Hi, how are you? Thank you. Happy to be back.
Great. And tonight's an exciting topic. We've had so much interest in this, and we decided to name it Beyond Ortho: How Soft Tissue Laser and Metabolic Health Expand Adult Treatment Options. So let's just talk about the title a little bit, Dr. Cohen. It's really, you had such a great point where we wanted to provide some insights on what to do when your adult patients, when they refuse ortho treatment. So I thought that was such an interesting niche topic because you deal with this every day. I remember as a hygienist, I had this every day. I recommended probably clear aligner all day long, and I didn't have 10 closes a day. So why don't you let's just talk a little bit just about the topic, and then I'll get into a little bit more of the details and welcome everyone.
Hi. So it's interesting. A lot of this has been through trial and error. And really it revolves around me and my personal story. As I've gone through my education and I went from being, primarily to making mandibular advancement appliances. And then I learned about, okay, well, now there's nasal breathing. And then I learned laser treatments, and then myofunctional therapy, and then, expansion and orthodontic solutions and orthognathic surgery. What I started to realize is the adult patient is way, way, way more complicated to treat than a child per se. And that's because a child is not as damaged as an adult is. We have, I had, as of a year ago, June, actually, I had severe sleep apnea. And I sit here today with no apnea. What did I do that was so transformative, to get me to a period of health? And it was a journey of what I was able to say yes to. I was told I needed surgery. I was told I needed expansion. I was told that my metabolics was not working well. I was told I wasn't breathing through my mouth. I was told that I had a tongue restriction. But I wasn't ready to say yes to all of those things in one particular moment. And as I started bringing this really holistic approach to my patients, I found that my verbiage had to change. I couldn't say, you have a deviated septum, you need to get it fixed. Your maxilla is set back, you need surgery, because I was just met with resistance because people didn't understand it. And I'm really good at explaining the why behind something. You have to meet a patient halfway. And as much as I would love to just go in and fix anatomy on everyone, the truth of the matter is people have very busy lives with a lot of responsibility. And I ask my patients for one thing: say yes to one thing. And if I can get you feeling better, then maybe tomorrow, maybe 6 months, you're willing to say yes to something else. And that's where I really took this journey of being able to offer multiple treatments for patients so I can help them. Because if I help them at one stage, it's going to be easier to help them at another stage as their body starts to feel better. We all go to the gym. It's like the hardest thing in the world to do. But then like 2 weeks into it, the 2 weeks of dread, I call it, when you start to feel better, the exercises become easier. You start to notice a difference in the mirror. All of a sudden, you start to say, I want to go to the gym. I want to feel better. And that's really the same thing of what I try to do and what I try to expose my patients to each and every day.
So I'm so excited for this lecture. Well, it's not really a lecture, but it's kind of an overview of how you incorporate soft tissue as one of the options. And then we'll touch a little bit on the metabolic health, but we're also thrilled to offer this as a new course because there is so much interest. So with that being said, I wanted to let everyone know that we're going to have a raffle at the end. Raffling off free tuition to this new course featuring Dr. Andy Cohen, and it'll be called Integrating Soft Tissue Laser Therapy for Adult Airway and Sleep Health. So that'll be launching October 24th. And we're thrilled to have you on as faculty. I couldn't keep that in the bag tonight, so I let the cat out of the bag right away. So we're all level set that you know that you will have solutions to this and you can learn how to do this yourself. If you don't have a laser, you can still learn about it. And then maybe you want to consider getting a laser. And if you have a laser, you'll be well equipped to then implement this into your practice. Just some housekeeping items. First of all, I wanted to welcome everyone this evening. Thank you for taking time out to be with us. We're really thrilled to have you. I do like to see who's with us tonight. So let's launch our poll and see how many general dentists, how many pediatric dentists. I don't know if I'll get any tonight because it was an adult topic, but I'm always curious to see who's with us. So pick the best description. And if the one isn't there, I apologize. You can add it to the Q&A. You don't see your profession there. Okay, we have some pediatric dentists. Welcome. An orthodontist, myofunctional therapist, dental hygienist, speech language pathologist, other healthcare. So maybe you could put that in our Q&A. So pediatric dentists, thank you all for attending. We're here as long as you're here. We'll keep showing up to educate and bring airway health awareness to all. And I really think that this is such a great addition, Dr. Cohen. So thank you for taking your time to be with us tonight. Okay, here are the housekeeping items, and then we'll get rocking and rolling. To receive your CE, here are the results. 1 second. There we go. To receive your CE certificate, you must be in attendance for the entire program. Zoom software tracks attendance, so we do not need a code or survey at the end. And then just a disclaimer here, the views presented are the opinions of our speaker and are not necessarily affiliated with Lauren Gates and Associates in Airway Health Solutions. The following webinar is provided for educational, informational purposes only and does not constitute providing medical advice or professional services. And the information provided should not be used for diagnosing or treating a health problem or disease. Those seeking personal and medical advice should consult with a licensed physician or dentist. And then to receive your CE credit, again, just hang on to the end. I'll give you a reminder. But I'm going to go ahead and give you a formal bio because some of you may not know you well yet. We did have a master class with Dr. Cohen, with Jenna Schwibner, with Dr. Pia Gandhi, and also with Billy Arnold. So you can go to our archive. Maybe we'll put that in the chat for you all. If you missed that was a wealth of knowledge. So you can visit that at your convenience. But go ahead, I'm going to go ahead and give this very robust bio, and then we'll just jump in and take all your questions as well. So here we go. Dr. Andrew Cohen is a restorative dentist in Jenkintown, Pennsylvania, who specializes in dental sleep medicine, educating the profession about the benefits of treatments centered around both metabolic and anatomic options, enhancing outcomes for the sleep disordered patient, providing solutions that positively impact their lives. So you're in the right place, Dr. Cohen. Dr. Cohen graduated from Syracuse University in 1994 with a BS in psychology, and 4 years later, he received his DMD degree from Temple University School of Dentistry. He completed his general practice dental residency at Abington Jefferson Health and earned a diplomat status in dental sleep medicine from the ACSDD in 2019. So welcome, and I think we're going to start off by kind of showing and telling. We said there's a lot of questions here, but a lot of these questions, the answers aren't in a visual aid. So I'm going to go ahead and give you the wheel. You can go share some of your the work that you do by example, and then we can take questions as we go, or I will actually prompt other questions that were asked previously in the registration. So here you go, Dr. Cohen, kick us off.
All right. So where I'm coming from, I used to be practice more linear, and the linear was there is an anatomic problem. If you fix the anatomy, you will fix the patient. But I now understand that there are a lot of etiologic factors, and really you can enter the paradigm at any point. So what my strongest feeling is that it's our duty to inform our patients all of the options that they have. That's going to be both from an anatomic standpoint and a metabolic standpoint. And what I know is that if you combine the two, you're going to have a better outcome. I wish I personally would have known about my metabolic issues before I did MARPE, which most of you know, that's expansion of my maxilla. I did that in November of 2023. I am officially 2 weeks out from getting my braces off. So that's very exciting because it's been a long 15, 16 months. But I now will never know if it would have corrected my problem, if I could have just looked at it from a metabolic standpoint. Because actually, after I did the MARPE, I went from mild sleep apnea to severe. And I started asking questions like, why? If everything that I've been taught is that it's an anatomic problem, how could I get worse? So I had to dive into that, because what all of my mentors were telling me was that I needed to have maxillomandibular surgery to make more room from an anterior-posterior relationship. And to be honest with you, at 53, I didn't want to do that. So that got me thinking, well, I'm really educated in this, and I don't want to do it. Well, what options am I helping my patients understand? And I started to understand that there was metabolic and environmental factors that are ultimately going to cause problems for patients. And we need to get around just giving someone a quick fix. We need to be able to say, okay, tell me more about what's going on in your medical life and also what's going on in your environmental life, because they really can negatively affect the energy system that we have that really makes things go. So when I look at this, I loved when I made this slide, and the conversations that I now have with patients from a nutritional standpoint. I talk about ways that you can reduce sugar. That's how I actually entered the paradigm. I got a CGM, constant glucose monitor, and within like 2 months, my sleep apnea went from severe back down to mild. And I was only desaturating below 90% for 6 minutes, as opposed to an hour in that early June when I went to severe. Obviously, we have a lot of skeletal factors. We want to look at things in the vertical, the transverse, and the AP dimension. I really started to understand how negatively affecting our environment can be. The blue light we sit in. As a matter of fact, thank you for reminding myself about putting my blue light blocking glasses on, because the sun has gone down. EMF, which is electromagnetic frequencies, how those two things really disrupt our metabolic health. And ultimately how we need to power our mitochondrial function, our energy system in the body. And what I use as a marker for that is D3, vitamin D. If a patient has a low vitamin D, they're not in the sun. And if they're not in the sun, there's going to be an energy problem. And ultimately, what is the problem with having an energy issue? It's going to lead to disease. And this is not moving. Here we go. So what I try to talk to patients on this metabolic standpoint is, how can you reset your circadian rhythm? Because ultimately what we're trying to do is we're trying to reduce inflammation in the body. So how do I know personally that inflammation affects people's sleep? Well, I told you I have no more sleep apnea. I check my sleep every single night using SnoreLab, and my numbers are a 1, a 2, or a 3. If I have pizza at night, I'll snore, my score will be a 12, 13, or 14. What changed? What changed is that the pizza breaks down into sugar, and sugar causes inflammation in the body. Well, so is Alzheimer's, so is stroke, so is cancer, so is heart disease. They're inflammatory diseases. Poor sleep leads to inflammation. Poor metabolic health leads to inflammation. Anatomy problems lead to inflammation. That is why we have to take a multifactorial approach in helping people get healthier. So, what systems are affected with chronic inflammation? Well, if you can't process sugars, you get diabetes. If you can't process insulin very well, you get pancreatitis. Cancer is fueled by sugar and a blood supply, which is an inflammatory reaction. We know that poor sleep leads to high blood pressure, cardiovascular disease. You get stomach issues, irritable bowel, kidney issues, arthritis, autoimmune disease. All of these diseases have become more prevalent as two things have happened. Our anatomy in our faces are changing and getting smaller. We used to be able to fit 32 teeth in our mouth, and now we can't. We had an entire generation that had 4 bicuspid extractions. What is the long-term effect of that? And ultimately, we're seeing a population that is spending more time inside, less time outside, and we're seeing an increase in autoimmune issues, chronic disease, and obesity. Shoo, almost lost that one. So sleep apnea is exactly this. It's a chronic inflammatory disease. It's a soft tissue problem. And if the well, let me restate that. It's a bony problem that has the soft tissue over it that becomes inflamed. So if you are narrow in the transverse dimension, that tissue gets close together. It gets squished. If you have metabolic insufficiencies or dysfunction, that tissue is going to become inflamed because that's the body's reaction to a problem. It wants to fix it. And that's a never-ending loop. It's a loop of have an inflammatory reaction to try to fix it. The inflammation is ultimately making a soft tissue problem worse. Your sleep is going to get worse, and there's no repair and recovery that's happening. We need to figure out ways how we can help our patients. Is it anatomic? Yes. Is it metabolic? Yes. Is it environmental? And what I hope to, with joining with Airway Health Solutions, is to not only bring anatomic solutions, but ultimately metabolic ways that you can help your patients too. I think we in dentistry need to do a better job of explaining how we can help our patients take a more proactive approach because they're not getting it in healthcare. Healthcare is based in either giving our patients a medication or doing a surgical procedure instead of trying to fix the foundational problem. And that's what I aim to do. You know, we have
Dr.
a lot
Cohen,
of, yeah,
can I ask you a quick question? When you're
sure.
saying how important it is with metabolic health, how do you define metabolic health to your patients? Like, do they automatically know what that is, or how is there
No,
a simple definition? Right. So can
yeah,
you go into that? And then the opposite would be poor metabolic health. Can you say
yeah.
in patient-friendly terms how you describe that?
So metabolic health is making sure, well, I'll phrase it like this. Metabolic health is based in the science of physics. Physics is the foundation of our health. And what I mean by that is healthcare today is based in biochemistry. You have a biological problem, and we give a chemical solution for that. And what you're ending up doing is you're missing the energy system. So I'm going to bring in an old dental school terminology, the Krebs cycle or the TCA cycle. And ultimately, what we're trying to do is we're trying to make our body produce enough energy to run the systems in our body. If you don't have enough energy, the body will do whatever it can to protect your brain and your heart. So other systems will lose out on the energy and they will start to fail. That is ultimately the concept behind chronic disease. And what medication does is you get high blood pressure, they give you blood pressure medication. You get reflux, they give you heartburn medication. You have high cholesterol, they give you a statin. Instead of looking at, well, why is the system failing? So metabolic health tries to regain the energy system, and oftentimes that is done through sunlight. It is done through seeing the seeing the sunrise every day, and that creates red light, which is anti-inflammatory. It's getting UVA light, which gets the body's metabolic systems working properly. It's getting your vitamin D levels up, and ultimately getting melanin, which powers your mitochondria that run the TCA cycle. If that cycle isn't working well, it starts to process what's called ROS, reactive oxygen species. And that's when the body only produces 2 molecules of ATP. So there's an energy brownout, and an energy brownout is disease. So when I say metabolic health, I'm trying to restore the energy system in the body, which we can do if we learn about it. And that is what's called circadian biology. It's resetting your circadian rhythm so all of your clocks in your body are working efficiently and you make sure they're healthy. Now, here's the big kick. Blue light from our phones, from these lights, they disrupt our metabolic health. There are studies that show that when you enter in a room that is blue lit, your blood glucose will increase 10 to 15 points just by entering a room. So we know that if there's blood glucose and it goes up, that causes an inflammatory reaction. So that's how I'm describing it to a patient.
I'm just switching to my blue light glasses.
I know, right? It's like a blue pill. It's like once you learn about it, you can't unsee it. And you know, one of my favorite instructors, Gary DeWood at Spear, used to say, you don't know anything until you see it. Well, that's what happened with me. I learned about it. I dove deep into the science behind this because frankly, when I first heard that getting into the sun was going to make me healthier, I thought it was a crazy concept. It was completely out of the box from how I was taught in centralized medicine. There's a problem. Here's your solution. Well, the problem needs to be addressed at the foundation. And when you do that and you take in all the factors, you're going to get the best outcome. How is that for an answer?
I love it. I think it's very thorough. So can we get the elevator pitch version for your patients when they say, what is metabolic health?
That's it. Yeah, that did get a little long-winded. So basically, the metabolic health is looking at how we can improve your body's energy, reduce sugar, and fix the environmental factors that ultimately lead to inflammation in the body.
Perfect. Thank you. Okay,
carry
on. And these photos are all photos that you've taken, so I must comment on how beautiful. So
thank you. Yeah, that's Norway. That was the Northern Lights. And actually, the guy on the rocks there was our guide. He was taking pictures too, because whenever you see the aurora lights, it's really special. It was awesome.
Great.
All right, so just to dive into ways that we can help patients anatomically, nasal breathing, there's laser therapy, there's myofunctional therapy, and there's mandibular advancement appliances. Those are some non-invasive options. And then more invasive options would be actually making physical changes, a tongue tie release, MARPE, orthodontic solutions, septoplasty, and MMA. So those are the options that I give my patients, and what I ultimately ask them, not only why I broach the subject of metabolics with them, but then I also show them through a review of findings, through going through a CBCT, and I have a case that if we want to look at it later, I can go through how I work up a case, how I'm able to make the suggestions that I think work for each patient. You know, everybody is different. We can't just put a square peg into a round hole. We have to give our patients options, and we have to meet them in the middle, because not everyone is ready to take that leap into a more invasive procedure. Maybe it's that they're afraid. Maybe it's financial. Maybe it's that they just have too much going on in their life and they just want to stop snoring so they can get back into the same bed as their bed partner. We have to be able to listen and offer solutions. And that's what I think I'm really good at. This is just what Windows do. So I'm going to kind of end off right here and say that we need to really look at blue light. And everybody knows that you're supposed to put your electronics away before you go to bed. But there's a reason for it. The reason is the blue light tricks your body in your inside, tricks it into thinking it's daytime instead of it being nighttime. And that is grounded in your circadian rhythm. And if your body thinks it's daytime, you don't produce melatonin. And if you use your phone right before you go to bed and you don't have any blue light blocking glasses on, then you're not building up enough melatonin. And just like my wife, who wakes up at 2:17 every single night because she's using her phone or she was not wearing her blue light blocking glasses, and everyone in healthcare was telling her, oh, you have menopause. This is what happens. I say, well, maybe not. She started wearing blue light blocking glasses. She starts sleeping through the night. She wears blue light blocking glasses. Some of her sinus and some of her tinnitus in her ear starts to improve. These things have an effect, and we need to really help our patients out in understanding how we can fix them, well, improve the quality of their life. That's really what I'm fighting for. I want their quality of life to be better. We all have an expiration date. I know that's a depressing concept, but it's true. What we want to do is we want to try to maximize our life potential as much as we possibly can, because two things are going to happen. Our metabolic health is going to decrease, and that goes into energy, and our water in our body is going to decrease. If you don't have those two things, disease will come through, and that's what we're battling against. That's what we need to improve.
Wonderful. So I'm actually going to go ahead and invite you to share the workup, just because so many of the questions are about that. So
Okay.
again, let's kind of go through it, and feel free to ask your questions in the Q&A section, and we can answer your questions as we go. But I think that it's really great some of these questions would be better answered by seeing. Mm-hmm.
Sure. Okay, so if there are questions, you have to interrupt me because I can't see the questions on my screen. So I'm going to show you a patient that came to me about 3 weeks ago. She came to me because she had a whole host of medical issues, and specifically she came to me for TMJ. She was told that she had TMJ. She had life debilitating migraines every single day. She was taking light Lexapro. She was tired, and she had brain fog. She just was exhausted. And I would say that this started maybe 6 years ago, and she has been going from physician to physician, neurologist, functional health docs. She's tried medications, and nothing is helping her. So I don't assume anything. Everyone walks up. I work up every patient exactly the same way, and I break their I guess what I call the tour of the mouth, as Frank Spear famously coined. And for those who don't know Frank, he just got a liver transplant and is doing well, which is great. I break that into 5 sections, and the first is airway. So this is the questions or what I'm looking at from an airway, and where I check off, I tell the patient these are the areas of concern. So what do they look like? I do a profile, and ideally I want the ear and the shoulder to be aligned. Why wouldn't it? If they have more of a forward head position, it tells me 2 things. One, they're on their phone a lot, because we're all developing a forward head position. But 2, if their anatomy is somewhat constricted, by putting your head a little bit forward, it makes it easier to breathe. And then I'm looking at Andrew's line, and I want to make sure that the central incisors are on that line. And as you can see, right off the bat, when she walked into my office, I saw that she was maxillary deficient. So then I do a CBCT on all my patients, and her SNA angle was 66, and anything less than 82 degrees is considered severely deficient in the AP dimension. You don't need a CBCT to look at it. You just had to look at the patient from the side. All right, she had two septoplasties, and when I looked at her septum, that's clearly a deviation in her septum, but it's open. So both her nasal passage is open, and they would not technically classify that as a deviated septum. Well, then what is that? Okay, that's not normal straight septum. And what I also noticed is that she has nasal stenosis. When she breathes in, her nose collapses. So again, there's another little red flag that's saying, I don't think she can breathe well through her nose. I look at her airway volume and she's 106. Now I just use this as a predictor. And 106, it's a little, ideal is 150. 106 is like a little bit above okay. We'll put it that way. I get really concerned when someone's under 100. And then I looked at her soft palate, and her soft palate measured pretty good. I draw a line from the central incisors along the plane of occlusion, because now I'm looking at, is she a laser patient candidate? And you can see barely any of her soft palate extends below that line. So a soft tissue laser treatment is not really high on my list. But what do you notice in this picture? And this is something that you all need to really become familiar with. Her tongue doesn't get to the roof of her mouth. There's a lot of negative space in this region right here, which tells me that she has restricted tongue function. What does that mean? It means she's going to mouth breathe. What's my question I ask her? Do you wake up with dry mouth? Oh my God, it's bone dry. What happens when you get on your back, regardless if your soft palate is extended, your tongue falls back, blocks her airway. So immediately I'm thinking, wow, she's been going to the physician for 4 to 5 years. She's been telling people she's tired, but they're all treating her migraines. Did anyone think to screen her sleep? Would I be thinking sleep apnea? No, I'm thinking UARS, upper airway resistance syndrome. She's getting woken up multiple times a night. And I did the sleep screener, and she gets almost zero deep sleep. So she's not recovering. She's not repairing. She's basically in a sympathetic mode all the time. So I'm thinking two things right off the bat. If I do myofunctional therapy and maybe a tongue tie release, I'm going to do two things. One, I'm going to be able to create a proper seal for her and give her tongue function so she can initiate nasal breathing. I'm going to look at ways that I can improve her nasal passage. So there is a laser procedure that you can do to reduce the turbinate size of the nose. It's basically photobiomodulation, and I use the Fotona laser for that. And then I want to help her learn how to do nasal breathing and let me see what happens. But I want to prove that first. Oh, the second thing that myofunctional therapy is going to do is when you do myofunctional therapy, you're going to stimulate the palatal-pharyngeal region, which stimulates the vagus nerve. And when you stimulate the vagus nerve, it helps the body reset and get into a parasympathetic mode, which is really important for repair and recovery. I looked at her joints. She's definitely on her right side, a little bit, looks like that there's a loss of vertical dimension. She's kind of getting pretty close to bone on bone. And then I'm looking at her transverse, 29 millimeters. That is severely deficient in the transverse dimension. She needs expansion. She 100% said, I'm not doing that right now. I have 2 young kids. It is off the table. Okay. Well, I got to try to help her another way. Let me get her feeling better. Let me show her proof of concept, because I know that the tongue is the problem. So the picture on the left is when she just opens. Where's the air going to go if she's mouth breathing? And then the picture on the right is when she says, ah. And if you could notice in the center of her tongue, there's that depression. That is a classic sign of a mid-tongue restriction. All right, so then we get to looking at the tongue, and I'm looking at this area right here. This is where ultimately the back of her tongue is not getting to the roof of her mouth. I look at her aesthetics. Why am I looking at aesthetics? Because if aesthetics is an issue, ortho becomes a really good solution for her. She's narrow. So I look at her buccal corridor and she's insufficient. When I look at her smile, because she's missing her premolars, she's gummy. She has an uneven anterior plane of occlusion. It's almost like a reverse smile line. And then when I look at her, when she opens up, you can see that she has a step in the anterior. She's got a little bit of wear on her teeth, and she is entirely too young for wear. So this is the beginnings right here of pathway wear. And you can see a little chipping on her front tooth. And when I look at the posterior plane of occlusion, I want that to be everything to be on that line. And you can see it's not. Her upper teeth are too high up. Her bottom teeth are too, she has a step in her occlusion. And you can see that she has the same thing. So as I'm going through this, it becomes very obvious to her, I need to move my teeth, but she's not ready to do that yet. Okay, I can help her in other areas. But this is how I go through trying to explain all the ways that we can help her. I do excursion photos looking for any premature contacts. You can see that she's hitting on her second molars back here, which it's actually on her right side, which is where she lost vertical dimension in the condylar region. And when she slides to the left, you can see she clears. So obviously she's canted. And then I look at the structure, which the actual teeth, she has no problems, but you can see how deficient her premaxilla is and how it's almost like V-shaped, where we want it to be more U-shaped. Classic sign of someone who needs some expansion. Her teeth are healthy. I don't even think she had a filling, which is awesome to see. And then, I just take a couple other pictures. This is my CBCT position. So it's really critical when you're taking a CBCT. You want your angle to be 114 degrees, 112 degrees from nasion, celon to the cervix C3. And if it's not, every 5 degrees change in that angle can lead to a 25% change in airway volume. So I know that this CBCT was taken pretty well. And when I go through some of my courses, I'll explain how to set a patient up to take an accurate CBCT, so you're getting the best information that you can. So that's how I work up a patient. So what ultimately did we talk about with her? We talked about myofunctional therapy. We talked about initiating nasal breathing. We talked about orthodontics, and we talked about metabolic health. She spends all day in front of a computer. She has low thyroid levels. She has other hormone levels issues. So we want to look at her metabolic health and work. She actually is seeing, she came to me by an integrative medicine doc, and we want to see how can we work together to try to improve some of those numbers. How did I help her? I gave her nasal dilators and mouth tape, and she didn't have a headache for 2 weeks. That's what good sleep can do. For the first time in 6 years.
She came in 2 weeks ago.
She came in 3 weeks ago, and for the last 2 weeks,
Mm-hmm.
she hasn't had a migraine.
Wow. Okay.
And what we're doing is we're trying to turn around her sleep. And I think when we do that, that will start to make her feel better. And then she came back to me. She goes, oh my God, I feel so much better. Am I going to have to wear these dilators for the rest of my life? No. But I would love to do some orthodontics to help you get away from that. And that's the combination of trying to help someone out and meeting them where they're ready to go.
And then how do you introduce the soft tissue laser therapy to your patients?
Yeah, so if I go back, actually it'll be easier to do it this way. If I go back to this slide, if the soft palate would extend further below that line, so we only have this little part, then if this extends further down, then that's a patient who's a candidate for the soft palate. If the length and the width are significantly greater, let's say 45 to 50 in length and 11 to 12 millimeters in thickness, that's a candidate for a soft tissue laser procedure. If I look at their septum and it's deviated, and then I ask them to breathe in through their nose, I know that I can treat them for nasal stenosis. And I can actually prove that by doing the coddle maneuver, which is when you take your two fingers right by your nares. I'm going to try to get into the camera. You pull them out and you breathe in. Can you breathe better? And oftentimes the patients are like, wow, I can breathe so much better. That tells me that there's a nasal problem that's involved as well. And then the third area I'm doing a laser treatment for is when I'm looking at their tongue. And does this patient need to get a tongue release? Absolutely. I mean, there's no way myofunctional therapy alone is going to be able to get her tongue in the back up there. I need to be able to release that tissue. And whenever you see the frenum extend up right here where this indentation is all the way up to the tip, that's telling you that the muscles are really, really restricted. I have her do a lingual palatal suction in the chair. This is actually, the picture on the left is her attempt to do a lingual palatal suction, and she can't do it. It's like an epic fail. So that's all my patients. They always get myofunctional therapy before I do a tongue tie release, and then they do myofunctional therapy after. Those are the three major areas that I'm doing laser treatment for. And then the fourth is I'm a big fan of biostimulation and vagus nerve therapy. I use my laser for TMD patients, for pain, aches, pains, reset the vagus nerve. It's something I use pretty much every day. And I use it on myself all the time for my back, which is great. So
How long do these laser treatments take in your office?
The laser treatments take, well, that's a complicated answer.
Okay.
So let me go into this. I have two lasers. I have a Fotona and I have a light scalpel. And they ultimately both are getting the same, they're trying to get to the same result. Tighten the tissue, lift the tissue. Now, one of the benefits of using the Fotona is that you get biostimulation because the ND is in the red light wavelength family, which goes from 650 up to 950, which is a diode. And then the Fotona uses ND, which is a 1064 wavelength. The light scalpel is more similar to the erbium of the Fotona, which is trying to get tissue constriction, lifting of the tissue, shrinking of the tissue, collagen formation, similar to what we do in facial aesthetics. And the CO2 laser is going to penetrate deeper and faster. The erbium is going to penetrate more shallow, and you need more time. So the reason why I like the light scalpel, and I prefer that now, is strictly because of time. It has nothing to do with efficacy. So it worked as a better business model for me in the practice. So my Fotona appointments when I did night lays were, I like to talk, so 45 minutes, where the light scalpel, it's 15. I mean, and 15 would be a long time. It's more of me talking of that 15 minutes. And in our course that we're doing in October, I run through both of them and how I use both of them in my office, the settings, the protocol for each one. I have videos of how I do each procedure. I have videos of how I do nasal stenosis. I have a video of a tongue tie release. We have great educators out there for releases. I am not the best at that. I mean, Saruzagi and Richard Baxter and a whole bunch of people at Airway Health Solutions are much more proficient at teaching tongue tie release. There's a lot of anatomy to know. But that's how I'm using my laser to give people actual procedures to do in conjunction with my hope of doing metabolic solutions as well.
Love it. What are your thoughts on sunscreen if sun is beneficial? That seems like a big controversial topic.
Yeah. So, you really dropped the bomb on me on that one.
I'm sorry. It's right. It's right up on.
No,
I didn't
it's
ask.
okay. I mean,
Yeah.
I have to share what I know and what I believe. We have been led down the pathway that the sun is dangerous. If you get sun exposure in a proper, safe fashion, the sun is healing. How do I know this? Well, again, it's physics. So when we talk about melatonin, everyone thinks of melatonin is the sleep hormone that gets released in our body to help us sleep. And that is 100% correct. And we need that to happen at nighttime in order for us to sleep. That only accounts for 5% of our melatonin that our body makes. The other 95% of our melatonin is made in our mitochondria. And the purpose of that, it's the best antioxidant we have in our body. So what will happen is melatonin will bind with free radical and eliminate it. The sun is also drives two important processes: autophagy and apoptosis, programmed cell death and cellular repair. You cannot get them to work without sunlight. And ultimately, what if the sun was bad? Why does our body have UV receptors in it? So these are the questions that I want you all to start asking. I want you all to fact check me and find out why. And I can send you podcasts. I can send you information regarding the benefits of sun. When I say get out in the sun, I'm talking start out with 30 minutes at midday. That 30 minutes is not going to hurt anybody. And I'll tell you that I'm in the sun on the weekends from 7 a.m. to when it rises throughout the day until the sun sets. And that ultimately is how I was able to go from severe sleep apnea to no apnea. And when I took this information to my physicians, they laughed because they don't understand the physics behind it. They got one course in circadian biology and quantum biology in medical school. I've spent the last year and a half learning about it. So what's my answer to your question? I think sunscreen is terrible. I think you're putting chemicals that are carcinogens on your skin that the sun bakes into your skin, and that can be very harmful. I believe that skin cancer and frankly, most cancers are directly resulting from an inflammatory process because we don't have enough energy in our system. And if our system is running well, I mean, cancer is just normal cells that have gone haywire. We need to fix that. So ultimately, I think we need to just educate more. We need to look more, and we need to do it in a safe way. I would never tell any of my patients, go outside and sit outside for 6 hours. No, you have to build up to it. You have to get your body working properly in order to be able to do that. And it's a process, and it's learning more. And there are quadruple board certified physicians out there who are starting to get on board with this, that I actually share the podcast with patients. And it's also going to be in my course that I do. So.
Thank you. That was a very thoughtful answer and educational as well. And I'm a sun lover, worshiper, runner, outdoorsy kind of girl. So I really appreciate the feeling good in the sunshine.
There's a reason why you feel good, and that's because the sun releases dopamine and serotonin. So we're meant to be addicted to the sun. I would ask anyone that may be rolling their eyes at hearing some of what I've said, and trust me when I tell you, when I first started going down this rabbit hole, I rolled my eyes too. I didn't think it was, I mean, it was against everything that I learned for the first 52 years of my life. Look up the Swedish study where they tested, it's called the all mortality study, where they tested people who were sun adverse and they died earlier than people who were in the sun. And it's like a 29,000 person study over 10 years. It's really, really convincing. Very well done study.
Another rabbit hole
Another rabbit hole.
It's never ending.
Yep.
Perpetual students. I love it. There was another question in the chat. What CBC T machine do you use?
So I have an iCat Flex. Any CBCT is good as long as it's full. If you're doing Airway and TMD, you need full volume. You got to be, if you're only getting both arches, it's just not going to be detailed enough for the anatomy that you're looking for.
Okay.
And if you don't have a CBCT, you can ask your surgeons who are doing implants to take one for you. I have a lot of people that I work with who that's what they have to do until they get a CBCT.
Do you have an age range or limitations to the laser therapy?
No. Anybody. I mean, I've done lasers on kids. The settings are a little bit different. They're not as long because the tissue is going to be thinner. But I mean, we're doing tongue tie releases on 3-day-olds, so no restrictions to a laser.
Okay. How many airway patients do you typically see in a day? That's your question, I guess, right?
I would say probably 30 to 40% of my practice is airway and 60% dentistry. But my goal would be to transition fully into doing airway. I just haven't found the person to do the dentistry yet.
Yeah, I love that word. Okay. Well, that was really helpful. What I want to do is now just go over some of the course work that we are going to offer and officially welcome you to our faculty. So I am thrilled. I know Dr. Moralia and you're both the keynote speakers at the Breathe and Thrive concert. You're going to be lecturing, co-lecturing together because a lot of your philosophies are straight on, are on the money. So we're really thrilled to have you as a faculty and help us dive down this rabbit hole to offer more solutions for our patients. So it's not such a deep rabbit hole to get out of. So we're thrilled to have you and thank you. And let's talk about this new course. When you were talking to me about your goals and desires behind it and what you've been doing, I really felt like this had to be shared with all of our alumni and future alumni as well. So just give us a little bit of overview on your passion and your goals for this course.
So what I wanted to do is kind of create a course that in a nutshell gave providers another option somewhere the in-between of your appliance dentist who is just making, let's say, mandibular advancement appliances to the more extreme of orthodontic and surgical interventions. It just didn't seem like it was an all or none solution. So as I got trained in laser treatments, in, like I said, both the Fotona and the light scalpel, there was definitely an area that you could provide a really good service to people to help them start the process of feeling better and get them to start to say yes to something. And I run through all the different aspects of how I'm using lasers in my office, the actual procedures, the settings, the protocols that I'm using, and the studies that are behind them, showing their efficacy and giving you my experience with them. I have some patient testimonials that I share. That patient, there was actually in this course, I will be releasing for the first time two patients that never had it done, and we have their testimonial. This was August 6th. We did it, and you have their before and after testimonials, and I was not in the room for either one, so I'm going to share you literally what they said. So I'm excited.
I'm excited too. And we're going to put the link in the chat if you wanted to. It's going to be October 29th. And we do have a flash sale for those who are with us tonight because we love your commitment and that you're here showing up. So this is exclusive to you. If you wanted to take an extra 10% off, our introductory fee is $4.99. But if you want an extra 10, we're thrilled to offer that as well. But you need to sign up by September 10th at midnight. So is that, oh, maybe we can be a little bit more lenient. It's only 3 hours, but let's see if we can extend that till tomorrow. I'm sure we can because it's also late for some of our East Coasters. But
I think it's October 24th, not the
20th. Oh,
24th.
I'm sorry. October 24th. Thank you very much. Yes. So October 29th is another conversation that we'll be talking about. So we're thrilled, and if there's any questions about the course itself, you can go ahead and ask us that. I'm just trying to find my mouse. It's kind of lost here. 1 second so I can find, there we go. Okay. So that's that. We're also thrilled to have Dr. Matlau, as we saw in the last conversation that we had. She's joining faculty as well, and she'll be having our course in February. So a lot of new things are happening at Airway Health Solutions, and we're thrilled to even offer more faculty announcements at our Airway Palooza. I know we announced Dr. Pia Gandhi and also Dr. Jenna Schwibner, but we have more coming. So hang on tight, and we're really thrilled to announce other faculty at Palooza. But we also have different specials that you can look at when we're in our follow-up email. I don't want to take too much time because it's coming up at 9 o'clock, but we're here for you. As you know, if you ever have any questions, you can set up a call with me. I'm happy to go over a specific pathway for you. But here's our courses with Dr. Ben Moralia, and then we have our courses with Dr. Gelb. So there is a pathway here, especially if you're newly starting. It can be overwhelming, and I'm happy again to review that with you. There's a pediatric pathway, there's an adult pathway, but it depends on where you are. So take advantage of setting up a call with me, and we can review that. We do have 3 spots left open for our Mayo course with Brittany Sierra Murphy. So you may want to take advantage of that. We do cap out, so we do limit our class size to 25. So it's a nice, small, intimate course, so you get that one-on-one tension that you need. And we're thrilled for our upcoming conversation next week. We're having speakers for Airway Palooza. We're going to talk all about Airway Palooza and going upstream to prevent any type of airway dysfunction. And then October 29th, we're having a conversation with Dr. Umakant Katwa and Dr. Stanley Liu on pediatric airway health prevention from day 1. So mark these dates, and hopefully we'll see you next week for more CE and learning more. There's so much to learn. It's never ending. And we're also, I'm thrilled to be featured at the AAP MD webinar on September 29th. So I'll be talking with Howie Hinden on my journey as a hygienist, and how really every hygienist is an airway hygienist. You may just not know it yet. So how to combine some of your oral cancer screenings along with an airway screening exam. I'm just talking about the journey of how I went from clinical to Airway Health Solutions. So I'm looking forward to that, and I'm honored to be part of the AAPMD series with Dr. Howie Hinden. So here is the Airway Palooza. That's October 17th and 18th. Hope you guys can all come. We are almost sold out. Our room block is just about sold out. So if you're waiting, maybe this is your sign. We're happy to give you a discount as well for that. The coupon code, I believe, will be AP Convo 200 for $200 off our Airway Palooza. That's for the team and the doctor ticket. So I am just so thrilled with this night. We're coming up at 9 o'clock. Dr. Cohen, welcome to AHS. I'm so thrilled personally to learn from you. I know Dr. Moralia is also thrilled to learn from you as well. And we're looking forward to seeing you both together on the podium at the Breathe and Thrive conference. but more importantly, to sharing your wisdom October 24th on our platform. So you too, whoever's listening, can integrate this to give your patients more options, especially when they say no to ortho. Dr. Cohen, why don't you close us out with a vote of confidence or whatever you want to close us out with to make us all feel good.
Okay, that sounds good. So two things. Number one, if anyone has any questions that didn't get answered, just message Lauren and she will get it to me, and I will respond to you personally. If I can help, I would love to. And how I'm going to end this off. I want you to understand that genetics cocks the gun, but environment pulls the trigger. And my goal is helping you say yes to starting your journey tonight and then going forward. And any way that I can help you, help your patients become healthier, I'm excited to take that journey with you.
Thank you, Dr. Cohen. Thank you, everyone, for joining. Again, we're thrilled to have you, and we'll see you next week. For our Airway Palooza conversation, everyone. Have a great night, and we'll be seeing you around, Dr. Cohen. Thank you.
Have a great night.